So we got a call that the police department was bringing in a young man with a hand injury and that he was in police custody. That's all. That's the only information we got. He wasn't there for more than 10 minutes before a nurse from triage came out to talk to me and said that the patient that was in police custody over in the walk-in area was making derogatory comments to the nurses and the other patients in the area. He was swearing, he was threatening other people around him, and that the nurse in that area was starting to feel uncomfortable. So I went to talk to this individual. When I walked up to him, I introduced myself and let him know that we have a zero tolerance policy and that he's medically stable. If he wants to stay in the ER and be evaluated for his hand injury, that he needed to not yell swears or threaten people. And he immediately started threatening me and swearing at me. So I asked the police officer to escort him back out of the ER, at which time he immediately jumped up and threw a punch at me, grazing my head. I was able to move out of the way, but when he did, I realized he wasn't handcuffed. There was a set of handcuffs on his, I believe, his right wrist, but not attached to the other wrist, just like hanging freely. And I knew this because the cuff hit me in the head as he tried to throw a punch at me. And the police officer stood up and tried to hold him back. And he stepped forward and spit in my face twice. And the police officer continued to try to kind of gain control of him, at which point he pushed the police officer off and he picked up a metal folding chair and tried to hit me with it. I was able to put my arm up and I was able to block it with that arm and kind of grab hold of it for a second so that he couldn't keep hitting me with it. But then he was able to pull it away and he wound up again and he hit the police officer this time a couple of times with the chair. I was able to get the chair away from him. And at this point, the officer and myself were both trying to each grab an arm. And as we were doing this, he reached over and bit me really hard on the top, left side of my back. He broke the skin, drew blood. It was really painful. And I pushed him back and he continued to throw punches. He was trying to hit both of us. I was had stepped back and he was hitting the police officer, landed a couple of blows right to the police officer's face. And I looked up, and at this point, the police officer looked like he was not doing well. Eyes were a little bit starting to roll back in his head. And at this point, it really got hit home for me. It was really scary that I started to think about, well, if this person gets this police officer's gun, we're going to have an active shooter situation on our hand. So I immediately started trying to wrestle with him and trying to get him to the ground. Meanwhile, the other nurses in the area were trying to shuffle patients out of the area because it was like a wild scene of patients screaming, crying, people yelling, "Where's security?" I heard somebody yell, "Call 911." So I was continuing to mostly just me and the patient now in an all-out fight wrestling match, trying to gain control of this guy so that he couldn't get the gun from the police officer or hurt anybody else or escape from the ER. And after about a minute or two, our security finally came in and yelled, "Hey, stop," to the guy a couple of times. I don't think that they realized that it was really past that point at this point because they weren't there and didn't see how much things had already escalated. So I yelled to one of them, "Grab him." And we finally were able to kind of like pull him down to the ground. They did actually right away put into place that they had a police detail in the emergency room during our like times that they took a look at when a lot of these incidents are kind of happening certain times for the evening and overnight shifts. I actually, from my hospital standpoint, think that my hospital management was good. Like, I think that there's always things that could be done better, and I'm a nurse. I always think that we should have more staff on and would like to have more safety and security officers. I think there needs to be laws changed. I think that there needs to, all the laws right now are all worried about patients' rights and protecting patients from being denied healthcare, but there's no laws to protect the hospital or the nurses or the doctors from violent patients. At some point, our lives have to matter and our safety has to matter. I don't know any ER nurses that feel safe going to work. No.